Okay, quick poll question. What do we think about this? Can you legally dispense a prescribed, CD stands for controlled drug, to someone under the age of 18? What do we think? Okay, so yeah, women for their yeah, sorry, David. Most of you think that you cannot legally prescribe a controlled drug to someone under the age of 18. A couple of people think maybe you can. A few of you said you weren't 100% sure. Actually, we legally can dispense a prescribed controlled drug to somebody under the age of 18 for their pet's use. However, the ICVS don't advise we do this. So they advise against doing this unless it's under a clinical judgment and they've been judged that it is an appropriate medication to dispense by the veterinary surgeon. So legally, there is absolutely nothing wrong with dispensing a controlled drug to someone under the age of 18, but we do try and avoid it as much as possible. It is in a way, Ryan, but if you think, you say, for example, you've got a 17-year-old who owns a boxer that's epileptic, and they have quite serious seizures. 16 is the minimum age for medical consent, Sharon. So they would have to be at least 16 for them to give consent for us to give the medication in the first place. Yeah, financial agreements are over 18, absolutely right. Yeah, absolutely, David, that's correct. So say, for example, you had a 17-year-old who owned a boxer who had pretty severe epileptic fits, and they could occur in the middle of the night. The veterinary surgeon may deem it completely acceptable to dispense a rectal tube of diazepam to that owner, just in case their dog has a seizure in the middle of the night and their oral medication can't control it. So they need something to try and control that seizure to be able to bring the dog down to the practice. That would be completely okay. Legally, Sharon, they should be over the age of 16 to collect any sort of medication. Okay. Disposal of excess pharmaceuticals and contaminated equipment. Right. We're going to go back into the breakout rooms for this, just because otherwise it just makes it a little bit more interesting. It means that you can share some ideas. Those of you that have not been in practice, either for very long or at all, can be helped by those that are. So I'm just clear the statuses, I'm afraid. But can you just do another quick thumbs up, thumbs down for who's been in practice and who hasn't? If you're not very comfortable in practice at all, then give me a thumbs down. If you've only been in very slightly, occasionally. And it just means that I can sort out the breakout rooms accordingly. Right, give me 2 seconds just while I set up these breakout rooms. In fact, let me just put the other screen on and explain what I want you to do first. So within the breakout rooms, I want you to discuss what happens to unwanted drugs. So think about drugs that the client has when they bring them back. They might bring them back because they're not effective for their animal. Unfortunately, their animal might have passed away and they have a lot of drugs left over. What happens to unwanted drugs that the practice has? So maybe they've gone out of date. What happens to unwanted dangerous drugs? So these are your controlled drugs. Okay, so we sometimes refer to them as dangerous drugs. So again, the dangerous drugs that the client has and that the practice has. Have a little think, have a little chat, jot some notes down. Give me a second. I'm just going to try and set some breakout rooms out. While I just work this out. Right. So, what do we think? So, a couple of people from each group. What do you think happens to unwanted groups that the client has?
I think we must dispose of them, essentially, in the correct manner. We're not allowed to reuse or resell any returned products because we have no idea whether they've been stored correctly, if they've been tampered with, anything like that. So if it's just a standard medication, we can put them in the dupe bin. And if it's a dangerous drug, then we potentially need to have it witnessed and denatured before disposal.
Anybody disagree with that? Did anybody else come up with anything different with unwanted drugs that the client has?
I don't disagree, but I know that when my rat died, they did do most of his medicine, apart from I brought some back that were still in their blister pack, so I got my money back for that, and I think they just took it back because it was still in their blister pack. But I suppose it's because they know me, they trust that I haven't done anything stupid with it.
Yeah. Ryan, you think similar as well. So if the drug packaging is intact, has no special storage requirements, potentially we can return it onto the shelves. I've got a few other people messaging through as well. Loads of comments coming through. So, you shouldn't be reusing any medication. So basically, exactly as David has just said, you have absolutely no idea how they've been stored. For example, say they came into the practice in midsummer and they collected, I don't know, it just doesn't matter. So they collected something that's in, let's say, for example, a blister pack, or they collected maybe a bottle of Metacam, they haven't broken the seal. You have no guarantee that they've not then popped to Asda for an hour and left that medication in the car, and then that medication's been exposed to extreme levels of heat. And so if you did accept that medication back, even if the packaging is not damaged, the medication could still be affected. So Vicky, there's a bit in it, BSAV and medication guide. Oh, that is strange, Vicky, because the VMD alternatively states that you should dispose of unused medicines safely, never sell or pass on unused medicines to anybody else. Remember that it is illegal to do so unless you are authorised to store them. Now that could be directed at owners, not giving them to other clients. Regardless, it is best practice to never redispense medication. Okay, I know that there are instances, say for example, if it is a member of staff, when people have reused them, or I know of practices, controversially or not, that potentially would reuse things if it's for stray patients. So they may have an open bottle of Metacam, for example, that they use for stray patients in practice. But in gold standard best practice, every medication that is returned to the practice should be put into the DOOP bin, the disposal bin. You shouldn't be using anything that's left the practice, because there is absolutely no guarantee. You don't know that medication could have potentially been, I don't know, put in the fridge, let's just say, or frozen, if the owner got very confused about the storage handling and the storage needs of it. So really, you should be disposing of everything that comes back into the practice. Yeah, exactly. You don't know. I mean, it's much less likely, but you don't know that they could have put tiny little pinprick holes into the blister packaging, therefore changing it. They could have done anything. If they, grief affects people in many different ways, and they may try and do something with medication. You just have absolutely no guarantee, so you shouldn't ever really be dispensing medication that's been returned. Now, I know some practices will offer refunds to clients for medication that's been dispensed if it's not been used. So I know practices say, for example, if it's in a blister pack and the packaging hasn't been tampered with, they'll say, we can refund you for these medications because you've not used them. But practices are not, they don't have to do that. They're absolutely not. They're well within their rights to say, we sold the medication, you have to keep the medication. Well, you have to stand for the cost of the medication. A lot of practices will do it as a goodwill. Yeah, basically a kindness to refund. Yeah, Ryan. But then if they do refund, they still shouldn't be reusing the medication. They should be disposing of it. So, and they should be explaining to the owners, we can't refund you the medication. We can't reuse the medication. Unfortunately, that medication is but especially like you say, Ryan, if the pet's passed away, a lot of practices will refund some medication to the owners as a bit of a goodwill gesture. Especially if it's a particularly high vet bill. So what about dangerous drugs? Oh, I've got a comment coming through from Jenny. I'll just wait for a second, Jenny, so you can ask it. Oh, yes, yeah, definitely something we've got to be aware of. Yeah, insurance claims. Yeah, good point, Jenny. Well done. Yeah, absolutely. Right, so dangerous drugs, or controlled drugs as we also call them. What happens to unwanted, dangerous or controlled drugs? How do we dispose of these? Does depend on the drug, David. Absolutely, yeah. Good use of detail there. Some are brilliant, yeah, with what we need to do. Depends what schedule the drug is. Yeah, absolutely, yeah. So for Schedule 2 summit, definitely that is what needs to be done. Wait for David's comments to come through. Okay. You should denature all dangerous drugs, but you don't need a witness to watch you do this. Okay, so all your dangerous drugs should be denatured, but you only need a witness for Schedule 2 drugs. Yeah, ideally, Ryan. Yeah, I mean, some practices have a little bit more relaxed about Schedule 5 drugs. But yeah, so ideally, you don't necessarily need to use a denaturing kit. You can crush them, mix them with washing up liquid and water. You can mix them in with cat litter. When am I thinking if it's in a syringe, it doesn't need Good question, David.
There's something at the back of my mind that says, so if you were throwing out like half a bottle of ketamine that was out of date, then yes, you need to denature that.
Yeah.
If it's 0.2 of a mil in a syringe, I'm sure somewhere it says you don't need to do that. I might be completely wrong, but in the back of my mind, that's jumping out.
If it is a tiny amount in a syringe, so for example, when we're administering medications via injection, when you are noting them in the dangerous drug book, there is always a set amount that is potentially left in the hub of the needle that you don't have to denature. That is, it's a cost as a given. So say you would just draw up a mil of methadone, you would actually record in the dangerous drugs book that you've drawn up 1.05 mils of acetone, because there'd be a tiny little bit left in the end of the syringe. So for that tiny little bit, a little amount left in the syringe, then yeah, you don't have to denature it. However, if it was like a full mil of injection in a syringe, then you would need to denature it, if that makes sense. If it's just residual amounts, then no, you're fine.
Okay, thanks.
I've put into the lesson resources a PDF from the ICDS on controlled drugs guidance for you all if anyone's got any other questions about those. Yeah, absolutely, Ryan. Yeah, tiny little residual amount. It's not only going to be pretty difficult to get out of the syringe, but it's less likely to be misused or abused, yeah. Vicky, I've just noticed that you answered the question as well, so thank you very much for that. Okay, so maybe somewhat controversially, if a client returns a dangerous drug, the VMD actually advises that you should, if you're going to store it to be, so say it's a Schedule 2 drug that you need a witness to watch you destroy it, then you should store it in your controlled drugs cabinet. You should label it as returned stock, store it in your controlled drugs cabinet, but keep it separate to the rest of the medication, so that you don't have any errors in reusing it occurring, if that makes sense. So say you had dispensed a fentanyl patch to the owner, they had only used it for a few hours on the patient. So fentanyl is a Schedule 2 drug. A fentanyl patch is a patch that's impregnated with the medication. Let's just say, for example, the dog had the patch in place for 3 hours. They last for about 48 hours, and then they've returned it. You should put it into your controlled drugs cabinet, keep it separate, and wait until you can dispose it with the rest of the disposal of the medication. You can buy commercial denaturing kits that you can use for any out-of-stock controlled drugs, or you can use, as has already been mentioned, things like cat litter, washing up liquid, sawdust. You can crush your tablets, mix them with your washing up liquid, anything that will make sure that somebody can't then come around and remove the medication from the substance is absolutely fine to use to denature. You don't have to use a commercial test kit. Okay, a quick recap. So, somebody who hasn't answered any questions for a while. Claire, what do you think yellow clinical waste is for?
It's for stuff that's not infectious, but it's still definitely like stuff you use.
What do you think? I've got doesn't. It's purple. I'm going to come through Zara. Yeah, a lot of places do. So they'll have a bits bag, not the nicest of name, where they'll put the anatomical waste, shall we say, in there, and then usually that is then put into a red bag or whatever your crematorium company that is going to collect the waste prefer. The general consensus is that is a red bag. However, I'm sure those of you who work in practice, if you were to discuss what colour bags you all use, there may be some variation. So it does depend on the company that you're using as well. Yeah. A bits bag. Yes. And David, if you ever change practice, the cadaver bags are also usually always different colours, which is confusing as well when you move from one practice. So I've moved from practices where do not remove cadavers are in a red bag, but I've also worked in a practice where cadavers for individual cremation are in a red bag, which took some mind work from me to change my habits. As you can imagine, that wouldn't be a very good mistake to make. Yeah, definitely. And always double check. Right, it's 10:30, so we're going to go for our morning break. So we'll start back again at 10:45 and we'll continue. Jade, the general rule is that red is for body parts, but it just depends what practice you're at and what company they use, because there is sometimes some variation. But if you're learning this information with regards to a exam, red is for anatomical waste, so for body parts. Okay, so we're going to go for our break. Back, I was supposed to say back at, should I just type this? 10:45.